Hello, Namaste and welcome everyone to our educational channel. Today we are going to discuss about the introduction to Upadhatu. Let's get started. So basically Upadhatu word is made up with the two words Up and Dhatu. Up means the closer, nearer and secondary. So Dhatu means that such an entity in our body which bear and support our body and as well as which has the ability to undergo the further biological transformation in order to provide the nourishment to the inter and ongoing Dhatu. So such entity is called as a Dhatu. So here Upadhatu collectively what is the meaning of that Upadhatu word? So Upadhatu, which is considered as a byproduct of the Dhatu, which has some qualities and action as similar to their parent Dhatu, but which are in secondary form. So such entity is called as a Upadhatu. What is the etymological derivation of the Upadhatu? So Upadhatu means that which is closer, nearer, and similar to Dhatu. That entity is called as a Upadhatu as per the derivation. Now, what is the actual definition of the word Upadhatu? So, Sira, Snayu, Raja, Stanya, Tvacha are immobile entities. They formed from Dhatu and hence are called as a Upadhatu. So, here immobile is in the context of not having ability to provide nourishment to next Dhatu. So, they are produced from Dhatu. So therefore they are called Updhatus. Even though they are produced from the Dhatu, they do not themselves generate further entities from it. So it means that Updhatu are the byproduct of their parent Dhatu, which has some similar qualities and action as their parent Dhatu. For example, which is bear and support the warboard, but which does not have a ability to further undergo the biological transformation in order to provide the nourishment to the other entity in our body. So such entity is called as a Updhatu. For example, Sira, Snayu, Raja, Stanya, Tvacha. So they are considered as a Updhatu of our body. So now what is the process of the pathway of the formation of the Updhatu? So Ras if develop the Stanya and as well as the Artha and Rakta develop the Kandara and Sira. Mans develop the Vasa as well as the sixth layer of the skin and Med develop the Snayu. So it is according to the Charak. Now according to the Shadandar, Ras develop the Stanya. Rakt give the byproduct of the Raj and Mas give the byproduct of the Vasa. And during the biological transformation of the Meda, it provides the byproduct of Updhatu, that is the Swed, and Asti byproduct is the Dant as a Updhatu, and Majja byproduct is the Case, and Shukra byproduct is the Oj. It is according to the Shadanga. So, in pregnant woman, Ras Dhatu concerned to the develop the develop byproduct, that is the stanya, and in remaining period after menarche to the up to the menopause period, Ras is concerned to develop the Raja and Artha. So stanya and Artha are available in female only, and the rest Updhatus are common to both gender. So sometimes Oja is debated, but mainly not classified as Updhatu. Some texts include Oja as an essence or Sar or Vektadhatu, but not as a traditional Updhatu. So it is about the how the dhatus, Updhatus are formed from their parent dhatu according to the charak and as well as the shadanta. Now, what is the clinical relevance in regarding to the Updhatu? The disorders of Updhatus indicate dysfunction in the parent dhatu. For example, scanty breast milk or stanyakshay indicate the ras dhatu depletion, and snayu rog related to the med or rakta dhatu imbalance in our body. So what is the conclusion of all this discussion? So that the concept of Updhatu adds the deep to the understanding of body structure and function in Ayurveda. Though not as vital as the subdhatu, so they play a supportive role in maintaining physiological harmony and are important indicator in diagnosis and treatment. Thank you.